To understand more precisely what is meant here by non-specific biological stress, it is helpful to recapitulate the experiments and the interpretation of them which led to its recognition in 1936. It all began with a routine study of ovarian, which gave unexpected autopsy findings. The day after injection with ovarian extract, changes were found in the thymus, and in the stomach. Operations were discovered in one animal after another, with significant regularity. Most surprising was the finding of multiple elongated black hemorrhagic ulcers in the mucosa of the stomachs. Here, the normal gastric mucosa of an untreated animal can be compared with the ulcerated mucosa, which was found in the stomach of an injected animal. The thymus glands, like other lymphatic organs, were small, like the one shown here, compared with the normal-sized thymus. And adrenal glands were distinctly enlarged and hyperemic. The lower two glands merely show the cut surfaces. The uncut gland in the upper right-hand corner illustrates the increase in hyperemia. Histologic section was due to increase in the adrenal cortex. The widening of the cortex and almost total loss of dark staining lipid granules was striking. Here compared with the lesser width and darker lipid stain of a normal gland. It seemed time of these first experiments that a new ovarian hormone was about to be discovered. Contrary to expectations, however, the coarser, more impure extracts were more effect shown, whereas the more highly purified extracts were less of changes, as exemplified by the amount of ulceration which resulted with each extract. It was the more puzzling when extracts from other organs were tried. Also, extracts of tissues which had no direct relationship to the ovaries, and extracts that weren't even from endocrine glands. All produced the same changes. Were these changes caused by injury alone? If so, any damaging substance should bring about the same results. So, formalin was employed. Almost 2 days later, it turned out that the simple chemical compound, formalin, had produced the same thrills observed with tissue extracts. Hemorrhagic gastric ulcers. The thymus gland in each formalin-treated animal was involuted, as shown in comparison with the outline of a normal-sized thymus. And the adrenal glands were enlarged and hyperemic. An average-sized adrenal would fit in the square area formed by the crossed lines. Although all adrenal glands did not show as much enlargement as this one, all adrenals were brownish red due to decreased lipid content. The positive findings with formalin clearly showed that the entire search for a specific new active principle had led nowhere.
Well, this was a blind alley. But perhaps one might look at these same findings from an altogether different point of view. If agents so radically different from each other produce the same pattern of response, there must be in the body some kind of a mechanism through which all types of injury are met in the same way. Now that was the basis for our investigations,
and so in the following months and years, various forms of trauma were investigated. Physical agents, like excessive exposure to X-rays. Chemical injuries, like the administration of toxic substances. And even physiological stimuli, such as muscular overexercise. Or excessive exposure to intense light. Or mental stress, for example, due to prolonged immobilization. And many other agents that were tried all produced the same syndrome, as indicated by the changes in these organs. The body reacted to any kind of injury non-specifically in the same way with the same triad of changes. Every injury causes two kinds of effects. The specific effect is recognized from the various familiar lesions, which taken together are diagnostic of the particular injury. The other group of effects is common to all injuries. Thus, it is non-specific. If, for example, the animal is subjected to intense localized heat, the damage to the skin progresses. Finally, to carbonization, a specific effect of heat. In addition, however, this injury induces non-specifically the same syndrome of organ changes found with other injuries. Pathogenic bacteria, for example, injected into the peritoneum of an animal cause peritonitis, as expected. Later, at autopsy, this is diagnosed by the type of inflammation, characteristic exudate, etc. In addition, the infection causes the hundreds of changes induced by all other stressors, as represented here by these three organs, by which the syndrome was first recognized. Another example, the total deprivation of food not only causes the familiar signs of starvation, but like all other injuries, superimposed upon them are the same non-specific effects caused by any damage to the organism. This universal response is an organic manifestation of what is called non-specific biological stress, or ponos from the ancient Greek.
The expression stress as used here is a well-defined medical term. It refers exclusively to the non-specific effects of agents to which the body always responds with the same syndrome of organ changes, the general adaptation syndrome. GAS. The specific effects of diseases have long been recognized, and whenever possible, specific remedies have been devised with which to treat them. Now, the clear realization that in addition to their specific effects, diseases also produce stereotyped, non-specific effects, opened a new avenue for research into the very mechanism of being ill. This concept became an effective tool for research because in the structural and biochemical manifestations of the GAS, we found yardsticks with which to measure stress in objective terms. One result of following this new track was to bring out the important role of hormones in injury and disease. Another consequence of it has been to stimulate an enormous amount of research. Further study of the general adaptation syndrome revealed that it progresses through 3 stages. The first stage is the alarm reaction.
These 3 stages will be demonstrated with this animal. Marked to identify it later in the film, it will be subjected to a stressor until it has passed through the 3 stages of the syndrome. In this case, the stressor is low temperature. A refrigerated room is employed to expose the rat to continued cold, 2 degrees centigrade. After exposure to cold for 1 day, this rat is in the alarm reaction, the first stage of the general adaptation syndrome. If autopsied now, it would show the previously demonstrated triad of changes. The alarm reaction does not last indefinitely, no more than a couple of days. If the animal survives the alarm reaction and the stressor continues to be applied, in this case prolonged cold, it progresses to the second stage. Comparing this animal previously exposed to cold with another animal never exposed to severe cold, on the surface, there is no apparent difference. That a change in the marked animal has in fact taken place can be demonstrated by intensifying the stressor. This is accomplished by immersing both animals. And then exposing them to 0 degrees centigrade while wet. It will soon be apparent that the marked rat has become adapted to cold from its previous exposure to this stressor, because when exposed to the more intense cold, it fares well. Whereas, in time, the control animal, not having had the opportunity to become adapted to cold, dies in the alarm reaction. The cold-adapted rat, by surviving, demonstrates the second stage, the stage of resistance. Although the longest stage, the stage of resistance, also does not last indefinitely. If the stress is continued for several weeks more, eventually the animal reaches the stage of exhaustion, the third and final stage, which terminates in death. The pathways by which this syndrome works are as yet only partly known. For instance, the mechanism by which gastric ulcers are produced is incompletely understood. nor is the entire mechanism of the action of stressors upon the adrenal gland completely known. However, it is now well established that the pituitary plays an essential part in this mechanism through liberation of the adrenocorticotrophic hormone. ACTH in turn stimulates the adrenal cortex to secrete a group of hormones which cause thymico-lymphatic involution and which have an anti-inflammatory effect. For example, this rat is being treated with hydrocortisone systemically. This animal serves as a control. Dextran normally causes marked inflammation when injected into the soft tissues about a joint. So Dextran is injected into the hind paw of a rat treated with hydrocortisone. And then into the hind paw of an untreated control animal. Within a few hours, the difference in response can be demonstrated. The injected paw of the untreated animal shows a severe inflammation, while the Dextran-injected paw of the hydrocortisone-treated rat shows the marked anti-inflammatory effect of this hormone. The adrenal cortex secretes two groups of corticoids, which in many respects have opposing actions. One group, just demonstrated, consists of anti-inflammatory corticoids, the glucocorticoids. The other group includes desoxycorticosterone and aldosterone, considered here to be pro-inflammatory corticoids, the mineralocorticoids. These opposite actions will be demonstrated with adrenalectomized rats, each of which had a hind paw injected with Dextran 3 hours ago, and now sedated for photographic purposes. Compared with the paw of the untreated rat, the animal pre-treated with desoxycorticosterone shows increased swelling, while the one pre-treated with hydrocortisone shows almost no inflammation 3 hours after injection of the irritant. What is here considered to be a pro-inflammatory action is also observed with the pituitary somatotrophic hormone, the growth hormone. Acting directly, STH has an opposite effect to ACTH. ACTH acts through the adrenal cortex to supply predominantly anti-inflammatory hormones. The influence of ACTH on pro-inflammatory corticoid production is slight, if any. These pro-inflammatory and anti-inflammatory effects of hormones can be shown further by preparing a granuloma pouch. The animal is anesthetized, and a pocket of air is created in the subcutaneous tissue of the dorsal region. A fine needle is used so that air will not leak from the puncture wound. Then an irritant, such as 1 cc of 1% croton oil, is injected into the air sac through the same fine needle. Two weeks later, the air sac has become a well-developed granuloma pouch. Transillumination shows the redness due to vasodilatation. It provides a quick means of estimating the amount of exudate between the visible fluid level and the bottom of the pouch. The granuloma pouch can be dissected out for more direct inspection or for accurate weighing of the inflammatory tissue, which can be sharply separated from its non-inflamed surroundings. The accumulated exudate is easily seen within the granuloma membrane. The constituents of the exudate can be collected for an. Also, if desired, the total amount of exudate can be precisely measured. The pouch is opened, showing the appearance of the granuloma membrane, which formed its lining. To demonstrate some of the properties of this experimental tool for the study of local adaptation, a previously prepared granuloma pouch is employed. The exudate is first removed, and the pouch is reinflated. In another anesthetized rat, a pocket of air is created for comparison with the granuloma pouch of the first animal. This time, straight undiluted croton oil is employed. It is injected into the newly formed air sac. The same quantity, 1 cc, of the same concentrated oil is injected into the granuloma pouch which had been previously prepared with the diluted irritant. After 2 weeks, the skin of what had been a newly formed air sac shows a marked difference from the skin of the previously prepared granuloma pouch on the right, although both had the same concentrated croton oil injected into them. The unprotected air sac is now necrotic and demarcated by a dark hemorrhagic line. The pouch, lined with previously formed granulation tissue, was protected from injury. The effect of hormones on this local response to injury can be demonstrated with 3 adrenalectomized rats having recently prepared granuloma pouches of equal size. The control animal will receive no hormone treatment. It will serve for comparison. Desoxycorticosterone is administered daily to 1 rat. Hydrocortisone, similarly, is given daily to the other animal. Both animals were sedated for photographic purposes. After 2 weeks' treatment, the 3 animals are re-examined. The granuloma pouches show differences in size. They are most readily compared when removed. The pouch has increased in the animal treated with a pro-inflammatory hormone, as compared with the pouch from the untreated rat, while a marked decrease is seen in the granuloma pouch treated with an anti-inflammatory hormone. Treatment with what are considered here to be pro-inflammatory hormones, such as desoxycorticosterone, if given to experimental animals in large amounts over extended periods of time, can produce pathological changes having many similarities to those found in human diseases. This rat had received a prolonged course of desoxycorticosterone. This pro-inflammatory hormone, when given in excess, frequently produces nodules, readily seen on the mesenteric blood vessels. The points of resemblance of the nodule to periarteritis nodosa can be demonstrated by preparing histological sections for microscopic examination. As shown by this slide, the artery has hyaline material beneath the endothelium of the intima. In the adventitia, there is a heavy cellular infiltration and marked proliferation of the connective tissue. These inflammatory changes are considered to represent periarteritis nodosa. This is demonstrated at higher power by the hyaline deposits beneath the endothelium of a small artery. In another small artery, the hyalinization and swelling of the intima has progressed until the lumen is nearly occluded. Also, in the desoxycorticosterone-treated animal, the kidneys developed lesions, which earlier resembled nephrosis, and now sclerosis, visible. In this final stage, histologic section shows dilatation of Bowman's spaces. Shrinking of glomerular loops. And dilatation of many tubules. Some of which are filled with hyaline casts. As shown here at much higher power, where two degenerating, partly hyalinized glomeruli are seen. This section is taken from a kidney of a rat in a late stage of what closely resembles human nephrosclerosis. A glomerulus and its afferent arteriole are almost completely hyalinized. And there is extensive formation of scar tissue, which was seen grossly on the surface of the kidney as punctate scars. The heart also shows lesions after heavy dosage with desoxycorticosterone. Granulomas are grossly visible here as pale yellow nodules just beneath the surface. Histological sections show severe hyalinization of the vessels. And extensive cellular infiltration of the heart muscle. A pronounced diffuse myocarditis with beginning scar formation. At higher magnification, numerous caterpillar cells are seen, which are common in rheumatic carditis. Just beneath the endothelium is a large hyalinized focus of myocarditis, surrounded by granuloma tissue. Perhaps the most significant practical implication of all these experiments is that hormones play an important participating or conditioning role in what are primarily non-endocrine diseases. Since 1936, with the publication of this first paper on stress, an ever-increasing number of medical publications have appeared which relate to this concept. Some to take issue with it, others to confirm it, or to apply this concept to clinical problems. These papers are integrated in the Annual on Stress, which now list as many as 5,000 papers a year. It is frequently a major topic of discussion on the programs of medical conferences, as it was in Verona, Italy, at its International Medical Congress of 1955. But all these papers and conferences relate to stress based upon research which is merely the early foundation for a new approach to the understanding and the therapy of disease. Although many of these investigations have already found application in clinical medicine, much more still remains to be done. Only the future can tell to what extent this new concept, emphasizing the non-specific side to disease and the role of hormones in it, will in fact help the medical profession in its efforts to prevent and cure illness.
Il fattore stress